Welcome everyone to our webinar. The future is social prescribing, why it's a key to an integrated, accessible, and resilient health system. So my name is Natasha Baudet, and I'm the lead for social prescribing at the Alliance for Healthier Communities. We have some wonderful guests here today who will speak with great passion about their work in social prescribing. But let's get this meeting started in a good way by starting with a land acknowledgement. We recognize that the work of the Alliance for Healthier Communities and Alliance members takes place across what is now called Ontario on traditional territories of Indigenous people who have lived here since time immemorial and have deep connections to these lands. We further acknowledge that Ontario is covered by 46 treaties, agreements, and land purchases, as well as unceded territories. We are grateful for the opportunity to live, meet, and work on this territory. Ontario continues to be home to vibrant, diverse Indigenous communities who have distinct and specific histories and needs, as well as constitutionally protected treaty rights. We honor this diversity and respect the knowledge, leadership, and governance frameworks within Indigenous communities. In recognition of this, we commit to building allyship relationships with First Nations, Inuit, and Métis peoples in order to enhance our knowledge and appreciation of the many histories and voices within Ontario. We also commit to sharing and upholding responsibilities to all who now live on these lands, the land itself, and the resources that make our lives possible. So I encourage everyone to introduce yourselves and speak to the land on where you're zooming in from in the chat. I myself am zooming in from Ottawa, where I find myself on the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation, whose presence here reaches back to time immemorial. We recognize the Algonquins as the customary keepers and defenders of the Ottawa River watershed and its tributaries. We honor their long history of welcoming many nations to this beautiful territory and uphold and uplift the voice and values of our host nation. And now I'm going to hand it over to the CEO of the Alliance for Healthier Communities, Sarah Hobbs, for some introductory remarks.
Thank you, Natasha, and thank you everyone for joining us today. In 2018, the Alliance for Healthier Communities brought social prescribing to Canada. Our specific model is rooted in health equity and the belief that simply referring a client to a recreational program or local gallery is not enough. To be effective, we have to remove the barriers that prevent people from accessing community programs and services. Over the last 5 years, the model has evolved to include special population health focuses, such as Black health, mental wellness, and active living for seniors. Today, I'm so pleased to share that we are launching 2 final reports from our social prescribing projects. One is from the Links to Wellbeing Project, a partnership with the Older Adult Centres Association of Ontario, which connects socially isolated older adults with senior active living centres. The second project is Social Prescribing for Better Mental Health, which supports people whose mental health was most impacted by the COVID-19 pandemic. Some of the results we're celebrating today include over 1,500 and more referrals made for older adults through the Links to Wellbeing project, and that 90% of participants in the Social Prescribing for Better Mental Health project reported improved well-being after attending community programs and activities. We are so pleased about the impact of this important work, especially for those who face the most barriers to health. I would also like to mention a document created to highlight the benefits that link worker roles bring to healthcare organizations and to the healthcare system. The Alliance continues to advocate for innovative and cost-saving approaches such as social prescribing, team-based care, and health equity. I want to thank the social prescribing staff, members, and our partners for your leadership and collaboration on these projects. I will now hand it back over to Natasha to share some other high-level successes from these projects, and then we will shift into a fireside chat with some of the people implementing social prescribing across Ontario.
Thank you so much, Sarah. So I'll go back to my slides really briefly because I know PowerPoint maybe are not the most exciting way to discuss things, but I'll just share some of our great successes we've had. And then we have a really exciting fireside chat. So I know most of you are probably familiar with Zoom at this point, but here is um, a little Zoom intro, just some housekeeping. Your microphones are muted by default. You can answer questions through the Q&A panel at any time. We're here to support. If you have any technical questions, you can use the chat, and you can also raise your hand. So that's an introduction to Zoom in case you've never been on Zoom before. And I'll just take a minute to introduce you. This is our social prescribing team. So we're led by Dr. Jennifer Rayner. We're part of the research team. There's myself, there's Grace Higgins, our project liaison, Sam Chater, our knowledge translation and communications person, Joe Pham, who's our evaluation specialist, and Cynthia Lai, our administrative coordinator, who is supporting a lot of the work that we're doing, and including this webinar. Next slide. So to start us off, what does social prescribing look like at the Alliance? So it's really starting with that question. Instead of asking the clients, what's the matter with you? We say, what matters to you? And all of the social prescribing work that we do at the Alliance is based on our model of health and well-being. And at our Indigenous-led primary healthcare centers, we use the holistic model of health and well-being. And these are the values that guide all of our social prescribing work. Next slide, please. And as most of us probably already know, those who are attending this presentation, our healthcare only makes up a certain portion of our health. And so all of this 50% of what makes up your life, these social determinants of health, such as income, racism, colonialism, access to food, access to housing, income, all of those social determinants of health have a really big impact on our health and well-being. So I'll give you a little quick history of our social prescribing work here at the Alliance. So it all started with the pilot back in 2011. We worked with 11 different sites across Ontario to implement social prescribing, and each project looked different depending on the community and the center where we were implementing social prescribing. In 2021, we started Links to Wellbeing. This is our social prescribing for older adults, and it's a partnership with the Older Adult Centers Association of Ontario. And the goal was to connect socially isolated older adults with the benefits of seniors' active living centers. So we have about 200 healthcare organizations, including 31 Alliance members, and about 90 seniors' active living centers on board for this project. And we're always recruiting new health organizations. So if you're interested, let us know. In 2022, we started Black Focus Social Prescribing. This project is the first social prescribing initiative to develop and implement a social prescribing model grounded in Black and Afrocentric values and principles, with a focus on supporting families and children. We've made social prescribing culturally safe to improve health outcomes for Black people in Ontario. We're currently working with 4 sites and hoping to spread and scale this work to additional sites very soon. And this project just won an innovation award at the National Social Prescribing Conference. So it's an award-winning program now. And in 2023, our Social Prescribing for Better Mental Health project was funded by the Public Health Agency of Canada, and we worked with 28 different community centers to support clients whose mental health were adversely affected by COVID-19. So just a little snapshot into the Better Mental Health Project. So these were our objectives: to train service providers to implement social prescribing with a health equity lens, to identify individuals at risk of poor mental health, and creating tools for our EMR, to navigate individuals to the most appropriate services, working alongside 211 Community Connections to deliver a closed loop referral pathway. And participating centers also made referrals to internal and external programs. And number 4, to co-design and engage and evaluate and share impacts and lessons learned. And I'll just give you a snapshot of some of our outcomes from our 3 projects. So starting with the pilot project. So just moving on to the next, thank you. So here's some of our evaluations from the 3 projects. So with our pilot, we were able to find a 49% decrease in loneliness, 12% increase in self-reported mental health, 19% increase in social activities for clients. With Links to Wellbeing, which was a 3-year project, we had over 1,500 older adults referred to programs. 40% of the older adults described improved connections to community and improvements in self-reported mental and physical health. And 62% identified that their loneliness had decreased over 12 months. With our Social Prescribing for Better Mental Health, we were able to, which was an 18-month project, we were able to reach 2,935 clients across all projects. 90% of clients reported improved well-being after attending community programs and activities. And 84% of the professionals or service providers agreed that social prescribing helps address clients' complex needs. And 72% of clients who experience barriers receive support to help them attend programming. Similarly, with Links to Wellbeing, we're able to offer subsidies to cover the membership fees or to help buy supplies. So removing those barriers for our clients helps them access the social prescribing. I'll also share a snapshot from Black Focus Social Prescribing. We're just working on our final report, but something I can share is that food security was a very high concern for the clients accessing Black Focus Social Prescribing. So 88% of the clients reported being worried about running out of food before they had money to buy more, often and sometimes. And 40% reported not being able to afford balanced meals often and sometimes. And food security was our #1 prescription for this project. And if you look, I know it's a little bit tiny, but the #1 prescription was food security. The second one was uh, cultural activities. And you can, and 87% of the clients agreed that Black Focus Social Prescribing has made food available to them. So I'm gonna quickly keep going through slides, just giving you tidbits so that you'll want to read the final reports. So we also were able, with the Better Mental Health Project, we created 5 videos available online on our YouTube channel. So sharing how social prescribing is successful in different settings, nurse practitioner-led clinics, family health teams, community health centers, in rural settings, in urban settings, with different, working with different populations. We also worked with the Center for Effective Practice to build a clinical tool for clinicians who would like to implement social prescribing. So I have the link there, and that's available to everyone, any clinician who's interested in getting involved in social prescribing. Another huge successful outcome from our Better Mental Health Project was we were able to design modules for online learning for health equity focused social prescribing, again, available to everyone. And if anyone would like to become involved, we have our Ontario Community of Practice, which meets every second month. I know I'm whipping through things very fast, but I know everyone can keep up with and there's also the National Community of Social Prescribing and our online learning modules open to everyone. Those are free online learning modules for health equity social prescribing. And we've been working with the Center for Effective Practice, and we've just added our 10th module, which is targeting or focused for clinicians and for clinical staff to learn about social prescribing. And our final reports are available on our website. So if you would like, if this little teaser and giving you a little bit of information about what some of our successes have been is making you hungry for more, the Links to Wellbeing final report, the Social Prescribing for Better Mental Health report, and the link workers work document, which is a document we've been using to advocate for more link workers in Ontario, are all available on our website. So you can go to the next slide. Should be there. Oh, okay. I guess that slide did not get in, but all of our reports are available. We can put that in the chat. And if you are interested in more social prescribing resources and supports, that is our email address. So I wanted to keep my presentation relatively short so that we could move into a fireside chat and talk with the people who are implementing social prescribing on the ground across Ontario. So hopefully that wasn't too speedy of a presentation and we can shift over to our fireside chat. And I'm very excited for you to meet our great panelists. So I'm going to invite everyone to introduce themselves. And so just let us know, welcome panel, and just let us know who you are and what your role is and where you're working. So I will start with Heather.
Good afternoon, everyone. I'm Heather Klein-Gebank. I'm the Executive Director at the South Georgian Bay Community Health Centre. We were the part of the original pilot with the sector across the province. We've had social prescribing implemented now and very thrilled to be a part of the venture. Also acknowledging and wanting to share that we have expanded our social prescribing initiative. A couple of years ago, I guess just before COVID, we received a grant locally, which allowed us to work with community partners, and we expanded into green prescription, where it was time spent in nature, prescribing people time in nature. So similar concept of social prescribing, but very specific to time outdoors in nature. So with me today, I have Lauren Jeffries. Lauren Jeffrey is our community outreach coordinator, and she's been the face and the heart to our social prescribing and our green prescription initiatives at the community health center here. And so I've brought Lauren. I'm happy to sit in the back wings and answer any questions, but Lauren is definitely the face to everything in relation to this. And so I'll pass it over to Lauren.
Thank you, Heather. Hello, everyone. My name is Lauren Jeffrey, and I'm the Community Program Coordinator here at the South Georgian Bay Community Health Center. So I'll expand further on what Heather just mentioned.
Great. Welcome, Lauren. And Stephanie.
Hi there, I'm Stephanie Hemrick. I'm the Manager of Community Programs at Seaway Valley Community Health Center, which is located in Cornwall, about an hour outside of Ottawa and about 30 minutes away from the Quebec border. So like many of the folks that are on the meeting today, we've been doing social prescribing for many years in an informal process, with all of the groups that we've been offering and just kind of that upstream approach that we've been doing with all of our clients at Seaway Valley. We do have a very complex set of clients here. So those that are from the community health center sector know the kind of the SAMI score, the complexity of clients. So our clients do have a lot of complexities. And then we were initially part of the social prescribing for better mental health. So our part in that was actually formalizing the process. So formalizing our social prescribing so that it was a bit of a better oiled machine throughout the center with our primary care, allied health, community programs team. So I can share a bit more about that later on because we do have a bit of a different model from the link worker model whenever we operate. So glad to see everyone here.
Great. And how about you, Beth?
Hi, everybody. My name is Beth Komanek. I'm a health promoter at the Chatham-Kent Community Health Centers, and our model is a little bit different too. The health promoter myself and Allison, we work directly with the clients to get them connected, and we've been able to expand a lot of our programming within the past couple of years to really try and incorporate things outside of exercise and really dive into the more social groups that involve like reading and painting, all of those kind of fun things that we don't always think about.
Great. And Margot.
Hi, everyone. I'm Margot Riley. I'm the Executive Director at the Windsor Family Health Team. My journey with social prescribing goes back to about 2017 when we were involved in the Health Tapestry program at McMaster University, focusing on social isolation and loneliness. It was a research project for seniors. And ever since then, we've been hooked at our family health team. I was at a previous family health team. Now I'm in Windsor. And what we've learned is that there is a connection to social isolation and loneliness, and we wanted to expand on those programs. And we've done a number of research projects and initiatives We've also been working with the Alliance with social prescribing for better mental health. And we've developed a few very social prescribing focused programs that help advance our initiative and specifically with oral health education. I'm happy to share more later.
Great. So what I was thinking with this fireside chat, this amazing panel, is we can hear stories about how social prescribing works in different settings, in family health teams, in community health centers, in rural settings, in urban settings, in large centers, in small centers, and how it can be implemented in a unique way depending on the setting and the community. But maybe I'll go back to Lauren. And do you want to tell us a little bit more about what nature prescribing looks like at South Georgian Bay?
Sure. Thanks, Natasha. Well, as Heather mentioned earlier, we were so fortunate to be the recipient of a grant at our local hospital here in Collingwood, and that was through the Wellness Innovation Fund. So we received a grant to provide nature-based prescriptions and activities, expanding on our social prescribing concepts here at our community health center. Not only for our patients that took part in the pilot project, but for the community at large as well. So what that looked like was really educating our healthcare providers about the importance of spending time outside in nature, hoping to really increase our patients' overall mental health and well-being. And so what we did, we created a pilot record in the EMR where our providers could refer our patients to nature-based activities. So through this, we had about 1,700 patients at the time at our health center, and we ran a report where 439 of those patients had a diagnosis of depression or anxiety. And from there, we did a non-biased sampling of 40 of those patients to take part in this pilot project, which took part over about an 8-month period. And from there, what we did is we took the concept of social prescribing, creating new programs, and really created programs that would offer patients time to spend time outside in nature. So what we did, we partnered with local outdoor education groups, with our local health unit, our local municipalities to really offer those supports and services to our local trails. We offered our patients in the pilot study or pilot project passes to Ontario parks in our region. We reduced those barriers, as we've all been discussing, that really support social prescribing. We offered individuals bus fare, taxi fare if they needed to get to these nature-based activities. And from there, we created more programs, we expanded. So that's through forest therapy walks. We engaged the community in community cleanups. Just anything really nature-based that would get people outside, encouraging them to spend 20 minutes or more a day, which we know the evidence shows that will have that impact on someone's overall mental health and well-being.
Great, very interesting. So give me an example of what a prescription might have been, a nature prescription, like a hike.
It could have been a hike, Natasha. It could have been a gardening activity, the community cleanup, like I mentioned earlier. We created walking groups for individuals to come together and spend time outside in nature. We would even involve our healthcare providers, so our dietitian, our diabetes educator, some of our social workers to join in on these nature-based activities through social prescribing to really offer that health and wellness information, but on the outdoors.
Great. And let's shift over to Stephanie. Can you tell me a little bit about what social prescribing looks like at Seaway Valley in Cornwall?
Great, thanks, Natasha. So at our community health center, we're fortunate in that we're well anchored with many of the community partners, and we have a lot of great community assets. So we're a relatively small city of about 50,000 people. And we also have within the community health center a lot of programs that are being offered, but sometimes some of the disconnect was between the clients in primary care and then connecting out to the bigger pieces. Because as we know, sometimes whenever you have someone in front of you and it may be more problem-based, they may just be focusing on that. So back in 2017, Seaway Valley Community Health Center actually developed an interdisciplinary model called the Bridges team. And the goal of this team member was to support all of the team members around kind of like a shared care model. So the idea was that any client that they would have worries about at night, that would keep them up at night, that they were to refer to this mechanism. So that was the idea that, you know, on this table, it was a weekly meeting that we had. We had representatives from management on the community side, as well as on the primary care side. We had a health promoter, a social worker, nursing staff. We had the person who oversees the volunteers. So whenever they would do a case discussion, and it was done via our EMR, the referral, around how we could best support this client, and the information would go back to the provider. So with that model, we just piggybacked on that model and used it for our social prescriptions. So whenever the provider would have, or the healthcare professional would have the client in front of them, they would say, you know, what matters to you, or what were your interests in the past, or what do you enjoy doing? And then they would be able to just send a referral over to the team that meets weekly, and then we would discuss, and then we would actually follow up. So it was a shared responsibility team, because there was always the piece like, who's going to do what? Is the provider supposed to follow up? Is that a good use of their time? So then with this team, it's someone that's at that table will follow up with a concrete action or concrete piece to follow up on. We found really great success with our providers because they've then seen their clients engaged. One of the recent social prescriptions we had was around someone going to and doing some pet therapy, but with like at a rescue where they had like goats and turkeys, and they were able to go work with them there. That was really unique, and we had a bit of resources to be able to coordinate that. We've coordinated some painting activities as well for some clients. So really thinking outside the box. And this model, obviously, if we had funds for an ongoing link worker, that's probably what we would go for. But this is really an absence of base funding, and really wanting to have that sustainability piece for our social prescribing model.
What I'm hearing from you is it does free up time from the clinical providers to be able to triage to this other group.
Yeah, like they already have the therapeutic rapport and the relationship with the client. So they're able to ask that really great question and kind of see, you know, well, you used to be involved in this and it sounds like you might have an interest, and then they're kind of able to pass it over. So yeah, it has worked out really nicely. And one of the pieces that we found is we have some clinical champions who's just part of their work. And whenever we bring on some of the new staff, with the providers, it's just like, this is how we work here. We just ask the client these questions, and then you just send the referral off to Bridges. So it's less about, you know, maybe you could do this, around like, this is just the way we operate here.
Yeah, so it's a different way of working, and it's just kind of infused into every aspect of your center.
Yeah, exactly.
Great. Okay, Beth, let's hear what's happening at Chatham-Kent.
So we're in the same boat as Stephanie. We didn't have extra funding for a link worker. So we built it into the health promotion role so that we knew that it could be sustained over time, and that there was always someone following up that is not quite clinical. So, you know, and not quite social work. We kind of sit in between everything, which is really nice. So we've made everyone aware that, you know, when you think of this, think of health promotion, which has been a great aspect. So we've been doing a lot of social prescribing before we even think of it as social prescribing, even just connecting people with groups. And our clinicians have really liked it because they've noticed a lot of things in terms of, you know, we need help with funding, or we need help with transporting this person, or we see that this person, you know, is very socially isolated, and it's just things they don't have time to work on. So sending it to us, and then us being able to do a warm loop back in with them, just so that they keep in touch. And we've had some really great successes, and even just looking at social prescribing from a different way. Like before we had the Links to Wellbeing program, we were looking at ways, how can we partner with our adult activity centers and kind of reduce some of those barriers of cost, because we only have limited resources in our community. And what are some other programming options that we can bring in house so that then clients aren't having to pay for things, because we found paying for things and transportation as big barriers. So really kind of looking at how can we feasibly do a few things and get people engaged, and then they're not, you know, calling the clinic as often, or, you know, their mental health is just so much better. And we've had a lot of really good success stories out of programs that we never really thought we would get those really good client stories out of.
So it sounds like you were able to connect with some of the free programs already happening in your community, so there isn't necessarily an added cost for you or the client. And the other interesting piece I heard was using the EMR so that the clinicians can see, oh, the client was referred. That's why their mental health is better. They're attending a seniors active living center or
Yes, we're really grateful that we can be in the EMR and work it that way because it makes everything just a nice smooth transition. So for us, our next steps is how can we pull that data from our EMR to really show the success in numbers as opposed to just all the amazing qualitative stories that we have throughout the office.
aha. And I guess one of the things the Alliance can offer is we do have forms that people can put into their electronic medical record. If anyone attending this webinar is interested, we're happy to share all of our resources. And now let's go over to Windsor. And Margot, do you want to give us a snapshot of what's happening at your family health team?
Sure. So I actually don't think that we're operating too differently from my colleagues here, but I will add some, I'll mention the differences. So one thing that we do really focus on, and we are going to be focusing on more, is the collection of sociodemographic and race-based data, and using this data to really inform our social prescribing work into the future. And so this will be a mechanism that we'll use from a clinical perspective to help our clinicians make the referral to social prescribing. And also it will create an opportunity for our social workers to initiate, also our clinicians to initiate social prescriptions independently. And so we've embedded those forms and those referral pathways within the electronic medical record. We have a direct referral pathway via eFax and soon through Ocean with 211. And we're going to continue building on that partnership. Actually, our Windsor Essex Ontario Health team has now adopted 211 as one of their navigation tools. So just to build on social prescribing, and our Ontario Health team has also recognized social prescribing as a priority for our community. So those are things that are a little different from what I've heard from our partners. Perhaps are doing it as well. We are also looking at sustainable mechanisms to maintain the program without that additional funding. Family health teams are funded a bit differently from the CHCs. Being in Windsor, we are an urban family health team, so we have similar patient cohorts that we do work with. And so, we we're living in the same community, we're working in the same community. And so we want to be mindful that we need to provide wraparound care. And I think in addition to that, my last point would be that the focus for us is non-duplicative services. So if our community is funding or currently has programs and services and they have capacity to either increase or to take on more individuals by referral, we're creating those pathways through the electronic medical record to facilitate the referral pathway and really make it easier for the patient so they feel that they've been taken care of, and there's always documentation within the EMR for the clinicians.
I guess that helps with the client not having to tell their story over and over again. It's already,
Exactly.
yeah. The other thing I heard you say was that it was identified as a priority from the community. And like a follow-up question, how important do you think it is for social prescribing to be a priority for leadership at the organization for it to succeed?
I know it's important. And so I know that's a good question, Natasha. And so I am the cheerleader here at the organization. I've been talking about social prescribing for a number of years for the OHT tables, committees, anywhere that I can. Anyone will listen to me. They look at me. I'm like, hey, Margot, we know you like the social prescribing. But I think it's really important for us to continue advocating for that social component and the need to connect people in the community, but also facilitate connections. It might not be a social connection. It might just be, there's a subsidy. Did you know about it? There's this really neat program that only a certain number of people know about, but there's capacity. You should really take advantage of it. And those those conversations are really valuable for patients because they feel valued. And I think that is part of what social prescribing brings to the table.
I agree. So does anyone have any stories they'd like to share, maybe from a client's perspective or a clinician's perspective, or even from an evaluation perspective? Just opening it up. Yeah, go ahead, Lauren.
Go, Natasha. What made our project really unique? The concept of green prescriptions are out there in the social prescribing world, but what really made our project unique is that we attached data to this. So we did pre-surveys with our healthcare providers. We administered them to our patients. And then 8 months later, we did a post-survey follow-up. So what was really profound in the pre-survey results is that many individuals wanted to participate in social prescribing, in particular green prescription activities. They just didn't know where to go and how and who to go with. So that barrier of isolation. So that's what we did. We listened to our patients. We created those programs. We gave them those opportunities. And 8 months later, after our pilot project concluded, it was profound that 78.6% of our patients reported that they felt happier, more connected, their depression and anxiety decreased, and healthcare providers also reported that their patients were having better sleep, their immune systems improved. Just their overall health and well-being really had a positive impact by taking part in these green prescriptions.
Amazing. Yeah, I know I feel better when I'm, in my garden or walking in the Gatineau Park. So it's intuitive that you'll feel better, but it's great that you have evidence to back it up as well. Anyone else have any stories to share?
I can
Beth?
share two client stories, Natasha.
Okay, great.
So back in 2020, 2021, we started a book club because we were trying to think of some creative things that we could do where we provided the clients with a book, and then we met on Zoom, and it actually is still ongoing today. And we had one client who said that they were feeling very isolated. They didn't know what to do in the middle of the pandemic. They were really stuck in their home and reached out to the book club thinking, yeah, maybe I'll just a chance to talk to other people. And this client reported that then she made friends with one of the members of the book club. They started going on walks together outside, just the two of them. Then she hooked them up with another friend because they both had a mutual interest in, fostering adoptive kittens. And then there was a whole group of them, and they ended up going away to a cottage together. And I believe they still get together today, which is really fantastic and really what social prescribing is all about. And then as early as last week, I was talking to a client who came to one of our art classes, and they just stressed how much they loved coming to art classes because they've been feeling really down. And this is kind of like a bright spot in their day. And it opened them up to be able to express with us and tell us about some of the struggles they're having at home. And if they hadn't have gotten out of the house, then they wouldn't have talked about that. So then we were able to connect them to further supports to really wrap around that care. So sometimes that little doorway to just come in for social prescribing can really help with all the rest of the issues coming along too, if we look at it in reverse from just the normal clinical pathway.
Yeah, like it sounds like your groups were not health focused, but it became a forum or a place for clients to bring up some of their concerns in a really safe, trusting environment. And then that helped them connect to other health services.
Exactly. And it's nice that we can build that rapport even within the groups or just those individual one-on-one appointments.
Yeah, building relationships with people in your community. Does anyone else have a story, or maybe you want to share some of your programming? Yeah, Stephanie?
I can just share a bit of a unique perspective in terms of there's obviously the really positive client outcomes that we hear about. quite frequently. We have one person who ended up navigating through social prescribing, first starting off as this is actually quite common at our center, is that they would start off as a client participating in a group and then weave into a volunteer role and then be a leader. But we have one of our clients who through a social prescription was actually able to complete her GED, so her high school equivalency, through kind of that route, and is also still, or up until not that long ago, was volunteering pretty actively with Seaway Valley. So that's a great example. But what I wanted to share was actually just the impact on our team. So whenever we ask, like, what is the most, what do you think Bridges can do for you? And that's our kind of like our model for being able to support clients. And the one that came up the most was just around reduce provider burnout. So just the idea that folks aren't carrying the burden, or they're not carrying all of the work, and that it's really a collaborative effort to support clients. So they really feel that that's had a benefit. We've had some anecdotal evidence and even some data around, clients who tend to come for a lot of appointments. And once they start getting involved, either in groups outside the center or in the center, they tend to book less for medical appointments, which I think is the whole idea around social prescribing. And also we do see a reduction in ER visits, although that one's a little bit harder to quantify. So yeah.
Like I've heard clinicians say, oh, it brings joy back to my work, because sometimes, you have a client coming back again and again and saying, I'm lonely. And the clinician's like, I don't, I can't be your, you have a friendly rapport, but you need, so how do we solve this? And that's where I'm hearing, oh, social prescribing can support with some of those like wicked problems about loneliness or sense of belonging or just like meaning in life. And I have many stories like that as well, of working with a client who goes on to volunteer, and you kind of don't know where the social prescribing journey is going to go for the client when you first meet with them, because you just keep asking, oh, like, what matters to you? Okay, you want to join this group? Okay, you're ready to do some training and become a peer leader. Okay, like sometimes it's amazing where someone's journey will take them if you keep asking and building that relationship. Let's see. So wondering how, if about link workers and how you see, like, whether it's a health promoter or it's sort of this case management style or different, like how does that role of having someone that the clinicians can refer to, how does that support your work, or how does that work at your center? I've stumped them. Amazing.
I can, oh, sorry,
No,
go ahead.
No, it's okay. Go ahead.
Okay, sorry. So obviously that's our holy grail, is to make sure that to have sustained funding for a link worker, but that's also supported through a team-based approach. So I think that that's really important piece because of the loss sometimes of historical or information whenever there is a staff transition. But definitely if we had base funding, that would be the easiest, because it is a work off this side of everyone's desk, and it is in addition to everyone else's work. I think there's a real amongst our team, from leadership right down to, everybody within the organization, even the volunteers, they know that it's a value. So they really believe in doing the work, but it is extra work on everyone's plate. The social worker who already has an extra caseload might end up from that interdisciplinary meeting picking something up. So I think if there was the opportunity for sustained funding for social prescribing, there could be such value in that, and even really enhancing what the work that we do.
Great. And Heather, did you want to add to that?
I can add, just from an executive director budget perspective, we were very fortunate to have gotten a year of grant funding, and that's what allowed us to launch this, I guess, in some senses. And then we made the conscious decision internally from a budget perspective to reallocate some funding around in the budget to create this new position that Lauren is in now as our community coordinator. And so she oversees all the programs. Her role is really getting out into the community so that there's more awareness of who we are and what we do at the Community Health Center. Does a lot of speaking engagements, bringing more awareness around it. And the role has been instrumental in being able to onboard volunteers. And so instead of having paid staff running all the programs, by having participants come through the programs, the participants then take on that leadership role And they've taken over the volunteer of many of our programs. I would say 60% or more of all of our programs are now led by volunteers. We have hundreds of programs that we're offering. And so when we look at our reporting on our quarterly reports, we have been able to increase the number of group sessions and group participant attendances, largely driven by the volunteers. And so we shifted a position to create this, but then the number of group sessions and things has skyrocketed because of the one position. So from a logical perspective and a funding perspective, it took a year or two to be able to kind of get through that leg of it. And now we've kind of popped out the other side and are finding that there's a great value for that because of that position with that connection that Lauren plays between the volunteers and our community. So wanted to share that.
Right. And of course, the volunteers need a supervisor. They need someone to coordinate it. But what I'm hearing is that the volunteers were able to expand the amount of programs you're able to offer. The volunteers probably know what the community is interested in doing. And then what I also heard, like connecting that to what I heard from Stephanie, is like sometimes the volunteer role is the most meaningful social prescribing role for someone. When you have that opportunity to give back and like use your skills and participate, and that's very that helps us give a lot of meaning to our lives.
Thank you.
Yeah. Well, I'm feeling so inspired. So we will have probably a few minutes for questions if any of our audience have questions at the end. So any last thoughts? I know we kind of covered this, but just like any thoughts about how social prescribing helps helps reduce those primary care appointments or helps keep people healthy? Any thoughts on that? Like the prevention piece or the social connection piece?
I'll add to this this concept, and it's very much in a preliminary phase of developments, but I'll share the concept. And so what our family health team is connected or affiliated with our local hospital. And what we are going to do is we're going to look at discharge follow-ups and look at how we can automatically connect our patients that have been discharged from hospital to either social prescribing or to our clinical, they're not health links anymore, clinical care coordinators. And so we have two that are linked with our family health team. And so there is an automatic referral that is in development, and our clinical care coordinators are also very much embedded in our work for social prescribing as well because of the work that they do. It's just a natural fit. And so that is something that we are going to be implementing and looking at those natural synergies and looking at expansion. And then we're hoping to do an evaluation for any 30-day readmissions to see if there's any impacts there. So
Great.
very early days, but that is one of the plans that are in the works.
Okay, we'll have you back when you get the results so we can talk about that. How about, okay, I have my dream questions. So what does the future of social prescribing look like? And another way to put it is, if you had a magic wand and you could do anything you wanted to expand social prescribing at your center or to expand it across the province, like what would you do? Dream big.
I could start, Natasha. It'd be nice to see more dedicated roles to social prescribing and not just, like Stephanie had mentioned, everyone's adding it to their plate of what they're already doing. So it would be nice to see that funded. And it'd also be nice to see more more programs being funded that can be offered low cost, no cost. We have so many great opportunities in our communities, but unfortunately for those that we serve, it's so hard for them to be able to afford that when they're just trying to put food on their plates. So that would be dream big pockets of money coming our way, I guess.
Yeah, like to offer subsidies to remove some of those financial barriers and to fund the positions that we know get this work done and saves costs in other places in the healthcare system. Anyone want to add? What's your dream? What's your blue sky thinking?
I think similar to what Beth's saying and all the work that you're doing at the Alliance, just around like we know that the data is there. It's so clear that, you know, whenever people are lonely and there's social isolation, that they tend to have poor health outcomes. So why can't we just make the link and fund these positions? It seems like sometimes in the healthcare system, it seems like this far stretch, but it really isn't. So I think just identifying this and then really funding these positions, because there is just such value, right? And we know that like with the time that folks spend at primary care providers' offices and just that is just not a good use of resources. And there are people out there and there are networks and so many opportunities for people to be able to really flourish.
Even when I think about nature prescribing, you know, I worked at a community health center. It was downtown urban. And so many times there was this like longing for clients to get out of the city. And it's like, oh, if I could have only had a bus, I would you know, and I think some centers do this, like weekly get people out of the city. And yeah, we, any other blue sky thinking, some dreams here?
I'll add that I would love to see social prescribing be intertwined in some of the work that's being done in the shelter system. I think it would really help with our just the crisis that we're seeing here in Windsor, Essex, and I think that through other communities, I think that there is some science between social isolation and loneliness and in these populations as well. And I think that there would be a lot of value to dig in a little deeper and try to fund those positions to support these individuals.
Yeah. So we have a moment to take a couple questions. So maybe I'll just look through the chat and see if there's some questions for our panel. Okay, here's a question. So how to support folks who start social prescribing, but then become resistant or distant after initial meeting? How to bring people back in and build a relationship? So it's so much about building trust, building relationship. Anyone have an answer for that one?
I mean, I can speak to what we do. You know, this is definitely a challenge. It's funny because someone was speaking about this morning. So sometimes if there's a warm handoff that can happen, okay, this person's going to meet you here either through a volunteer, another staff, or a follow-up call, like, oh, that didn't work out so well. So kind of seeing where people are at and what are the barriers. But definitely that can be a challenge. We do find that having, you know, whenever I know that one of the groups that we have is a social gathering, and whenever people might come the first time, we're really intentional about making sure that either that a volunteer goes and speaks with them and tries to link them with other people, that there's follow-up after. And so I don't know, I'm sure folks around here have some other good ideas.
Yeah. Lauren, did you
Yeah, I was going to add, Natasha, that I think it's really important from our perspective of asking patients, the community, what their needs and wants are. Often we'll have people in our groups that will say, I would like to expand on this. So this is where we really tie in the volunteer component of volunteers giving back to their community. In my previous role at a different organization, it was so evident to me that if we would create groups that we would think would be a good idea, and then we weren't getting the uptake, it would be really going back to the people who are taking part in our groups and our activities to see what their buy-in would be and what they would like to see. Because if we're going to get people to buy into our groups and workshops, then we want that to be meaningful for them as well.
Yeah, I can definitely think of times when I was working at a health center where the doctor made the referral and said, this client needs physical activity. And then you meet with the client and you're like, what do you want? They're like, I do not want to do physical activity. Okay, let's find something that you want. And then maybe, you know, maybe it was just coming to coffee drop in for a few months. And then like 6 months later, they're like, maybe I'll try the chair exercise group. I'm ready now, but I wasn't ready 6 months ago. Like it's just kind of going at people's pace, right? Like I don't know if you've noticed, I'm a little bit high energy, and so I can't come in with a client and be like, do this, do that, do this. No, it's like taking your time and being patient and meeting them where they're at. Let's see if there's any other questions in the chat. I'm just looking through it. And also feel free to raise your hand. You can be unmuted if you have a question. Yeah, I don't see too many questions. I'm not seeing questions in the chat, so maybe we could end this webinar with any calls to action you have. So what call to action for someone working in a health setting, for decision makers, for funders? Anyone have any passionate calls to action? Who'd like to go first? Heather?
I can speak to the need to bring awareness. And I'm going to pass this over to Lauren. I'm just going to start with the caveat of awareness and having those conversations at community levels because of the work that Lauren was involved in on Friday. And so I will let Lauren share about that as an example of being involved and being connected at that level of awareness in your community.
Thank you, Heather. So on Friday, this past Friday, I was a panelist on the Nature Corridor Summit, which took place up at Blue Mountain here in Collingwood. And it was just such a great opportunity to share with some change makers and people really passionate about the environment and healthcare, how we can merge those two together and really portray and showcase the results that we had with our green prescription pilot project, and just having that embedded into our day-to-day work. So from there, it was wonderful. We've had a lot of media coverage over results of our pilot project. And from there, BC Parks Foundation had reached out to us, just wanting to know how we can partner, how we can have that referral that through the EMR so seamless, not only at a national level, but how we can really get down on the granular level here in the province of Ontario. So definitely more expansion in that to come. And I think, as Heather's saying, is getting our healthcare providers in the community at large to really buy into the concept of social prescribing, and in particular with what we've done through spending time outside in nature.
Great. In the last 60 seconds, any other calls to action? So thank you everyone for joining us today. I am available to stay for more questions. If people are able to stay longer, there will be a little evaluation sent out. And thank you so much to our wonderful panelists for sharing your knowledge and your wisdom and your experience. Thank you so much, and wishing everyone a great day.